I want you to stop what you are doing and look at your hand. Really look at it. Now, imagine for a moment that you are watering a garden, but someone is standing on the hose. The water stops flowing. The flowers at the end of that hose start to wilt. They turn brown, and they begin to die. Now, imagine a doctor looking at those dying flowers and saying, well, the only solution is to paint the petals green so they look healthy. My friends, if you are suffering from the burning fire of neuropathy, the electric shocks of sciatica, or that numbness that makes it feel like you are walking on blocks of wood, you have been painting the grass green for years. You have been told that nerve damage is progressive. You have been told that once a nerve cell dies, it is gone forever. You may have even been told by a very well-meaning specialist that your only option is to manage the decline with gabapentin, Lyrica, or painkillers that leave you in a brain fog. But I am here today to tell you that is a lie. It is a lie based on outdated science that we stopped believing in research circles 20 years ago, yet somehow it is still the standard of care in exam rooms across America and Europe. Your nerves are not dead. They are suffocating. They are gasping for air. And just like that garden hose, if we step off the line, if we remove the pressure, life rushes back in. I'm Dr. Alan Mandell. For over 30 years, I have treated thousands of patients who were told to get a cane or prepare for a wheelchair. I have seen men and women in their 70 seconds and 80 seconds, people whose feet were purple and cold regain sensation, regain their balance, and regain their lives. And we didn't do it with a new pharmaceutical drug. In fact, what I'm going to share with you today is based on medical wisdom from a text I have on my shelf from 1926 a time before Big Pharma took over the narrative, when we understood that the body is a self-regenerating machine. I am going to show you the specific nutrients that peel away the scar tissue, strangling your nerves. I'm going to teach you a forbidden breathing technique used by elite military units to force oxygen into your extremities. And we are going to fix the one sleeping mistake that is keeping your spine twisted all night long. But first, I want to prove to you right now, in the next 10 seconds, that your body is still alive and waiting for you. Do this with me. Take your thumb and press it firmly into the center of your palm, or if you can reach, into the arch of your painful foot. Push down hard. Close your eyes. Take a deep breath and hold it. Do you feel that faint pulse? Do you feel that pressure? That is not just blood. That is potential. As long as there is a pulse, there is a path. The door is not locked, my friends. It is just stuck. And today, we are going to kick it open. So, if you are ready to stop managing your pain and start reversing it, listen closely, because the protocol I'm about to give you isn't something you will hear in your next 15-minute appointment. Let's get to work. You might be wondering, Dr. Mandell, if the body can heal, why hasn't mine? That is the million-dollar question. To answer it, we have to look back at history. As I mentioned, I was recently reading a medical dispensary book from 1926, nearly 100 years ago. Back then, before the explosion of synthetic pharmacology, physicians treated nerve exhaustion and neuritis very differently. They didn't have synthetic blockers. They used things like liver extract, cod liver oil, and specific mineral salts. They understood something we forgot, that a nerve cell is like a high-performance engine, and if you stop giving it the right fuel, it doesn't just stop working, it starts to die back. What most doctors won't explain to you, not because they are bad people, but because the system is designed to treat symptoms, not causes, is the concept of the Vasa Nervorum. This is Latin for vessels of the nerves. You see, your sciatic nerve, the longest nerve in your body, isn't just a cord. It has its own tiny blood supply. Little microscopic arteries that wrap around the nerve to feed it oxygen and nutrients. When you have high blood sugar, or chronic inflammation, or you've been sitting in a way that compresses your lumbar spine for 20 years, those tiny vessels wither. They shrivel up, and the nerve begins to suffocate. That burning you feel, that pins and needles sensation, medically known as paresthesia, that is not your nerve attacking you. That is your nerve screaming for oxygen. It is a cry for help. And taking a pill to silence a scream doesn't give the nerve the oxygen it needs. In fact, some medications can actually slow down the mitochondrial function, the energy production within the nerve cell, potentially making the root problem harder to fix in the long run. So, let's get into the controversy a bit, because I believe you deserve to know the truth. There is a reason why natural compounds like alpha-lipoic acid or benfotiamine aren't prescribed in every hospital, even though studies from Germany and Japan show they have profound effects on diabetic neuropathy and nerve regeneration. It comes down to patentability. You cannot patent a vitamin. You cannot patent a naturally occurring antioxidant. But these compounds are the keys to the kingdom when it comes to nerve repair. Let's talk about the first pillar of your recovery, something I call the nerve rescue protocol. You need to understand that standard vitamin B1, thiamine, is water soluble. It's great, but it has a hard time penetrating the fatty outer layer of your nerves. Your nerves are wrapped in myelin, which is fat. To get inside and fix the engine, you need a fat-soluble version. This is where benfotiamine changes the game. It passes through that fatty membrane and boosts an enzyme called transketolase, which blocks the pathways that cause nerve damage from high sugar. It's like putting a shield around your nerves. I've seen patients who started taking high-quality benfotiamine combined with a specific form of B12 called methylcobalamin, not the cyanocobalamin you find in cheap multivitamins, which is basically a cyanide molecule attached to B12, but the methyl form that your body naturally uses, and within weeks, the ants crawling on the feet sensation begins to quiet down. But nutrition is only the fuel. We also have to look at the mechanics. You can have all the nutrients in the world, but if there is a physical roadblock in your spine, the healing signals cannot get through. Think of a garden hose. If you put a kink in the hose, the water stops. It doesn't matter how high you turn up the faucet. Many of you suffering from sciatica or femoral nerve pain have a kink in the hose at the L4, L5, or S1 vertebrae. I want to show you a movement right now. You can do this sitting in your chair. I want you to be very gentle. This is not about no pain, no gain. That is a myth that has hurt too many backs. This is about motion is lotion. Sit up straight. Extend your painful leg out just until you feel a tiny tension, not pain, just tension. Now, I want you to slump your head down, and as you look down, pull your toes up toward your nose. Then, look up at the ceiling and point your toes away. What we are doing here is called nerve flossing. We are literally gliding the sciatic nerve through the tunnel of muscles and fascia. When you have inflammation, scar tissue forms and the nerve gets stuck. This gentle gliding up and down, head down, toe up, breaks those micro adhesions. It tells your brain it is safe to move here. Do this 10 times. If you feel sharp pain, stop. You've gone too far. Back off. Healing happens in the zone of comfort, not the zone of agony. Let that sink in for a moment. Your body is designed to heal, but we have to speak its language. The language of the nerve is oxygen, space, and glide. Now here is something fascinating that brings us back to that 1926 wisdom. Back then, they used castor oil and magnesium salts heavily. Today, we know that magnesium is the master mineral of relaxation. But did you know that magnesium blocks the NMDA receptor? That's a receptor in your spinal cord that, when overactivated, causes central sensitization. That means your volume knob for pain is stuck at a 10. Even a bed sheet touching your toe feels like a knife. Magnesium helps turn that volume knob down, but you have to get it into the system. Taking magnesium oxide, the cheap stuff, is mostly a laxative. You want magnesium glycinate or threonate, which can cross into the nervous system effectively. And speaking of volume knobs, we have to talk about the silent killer of nerves, processed seed oils. In 1926, people cooked with butter, lard, and tallow. Today, we are drowning in soybean oil, canola oil, and corn oil. These oils are high in omega-6 fatty acids, which are pro-inflammatory. When you consume them, you are literally pouring gasoline on the fire in your nerves. If you want to heal your neuropathy, you must make a commitment today, right now, to eliminate these industrial oils from your kitchen. Replace them with olive oil, avocado oil, or good old-fashioned butter. Your myelin sheath, that protective coating on the nerve, is 70% fat. It needs good, stable fat to repair itself. You cannot build a healthy house with rotten wood. Let's shift gears to something that might surprise you. Your breath. You might be thinking, Dr. Allen, my feet hurt. What does my breathing have to do with it? Everything. There is a mechanism in your body called the vagus nerve. It travels from your brainstem down to your gut. It is the brake pedal for your stress response. When you are in pain, you hold your breath. You shallow breathe. This puts your body in fight or flight, which constricts blood vessels. Remember the Vasa Nervorum? Stress squeezes those tiny arteries shut. I want you to try the Navy SEAL breathing technique, also known as box breathing. But we're going to add a twist for nerve healing. Inhale for 4 seconds. Hold for 4 seconds. Exhale for 4 seconds. Hold empty for 4 seconds. But as you exhale, I want you to hum. Make a numb sound. That vibration physically stimulates the vagus nerve in your throat, which releases acetylcholine, a natural tranquilizer for your body. It opens the blood vessels. It floods your extremities with oxygen. I have patients do this before bed, and they report their night pain drops by 30 to 40% just from changing their state of mind and chemistry. Now, I want to address a sleeping habit that might be keeping you in pain. This is one of those hidden things that doctors often miss because they're looking at your MRI, not your lifestyle. If you sleep on your side with your knees stacked directly on top of each other, the top knee drags your hip down, twisting your lumbar spine and pulling on the sciatic nerve all night long. You wake up stiff and in pain. The fix is simple but profound. Put a thick pillow between your knees. This keeps your hips square. It creates decompression while you sleep. If you are a back sleeper, put the pillow under your knees. This flattens the lumbar curve and opens up the foraminal canals, the little windows where the nerves exit the spine. Give your nerves a vacation while you sleep. Let's go deeper into the forbidden knowledge aspect. There is a concept called autophagy. It won the Nobel Prize in Medicine recently, but ancient healers knew it as fasting. When you stop eating for a period, say 16 hours, your body stops using energy for digestion and starts using it for housekeeping. It identifies damaged cells, including damaged nerve cells, and recycles them. It cleans up the debris. Intermittent fasting can be a powerful tool for neuropathy because it lowers insulin, which destroys nerves, and boosts brain-derived neurotrophic factor, BDNF. BDNF is like miracle grow for your nerves. It encourages them to sprout and reconnect. You don't have to starve yourself. Just stop snacking after dinner and push your breakfast a few hours later. Give your body the window it needs to clean the house. I recall a patient. Let's call him Robert. Robert was 68. He had diabetic neuropathy in both feet and was told he would likely need a cane for the rest of his life. He was on high doses of painkillers that made him groggy and constipated. We started him on this protocol. We cleaned up his diet, removed the inflammatory oils and sugars. We started the Benfotiamine and alpha-lipoic acid. We taught him the nerve flossing. But the biggest change was his mindset. He stopped viewing his body as broken and started viewing it as healing. He committed to the daily ritual. 6 months later, Robert walked into my office without his cane. He said, "Doctor, Mandell, I felt the feeling come back to my big toe last week. That is the power of the body. It is waiting for you, but you have to be careful. There are things you are doing right now that might be making it worse. Ice, for example. We are told to ice pain. And for a fresh ankle sprain, ice is okay. But for chronic nerve pain, Ice constricts blood vessels. Remember, the nerve is starving for blood. If you ice a chronic neuropathy, you might be starving it further. Heat, specifically moist heat, is often better because it dilates vessels and brings nutrients in. However, the best is contrast therapy. Warm, then cool, then warm. It creates a pumping action, but never frees a dying nerve. This brings me to a controversial topic, cholesterol. You have been told to lower it at all costs. But did you know that your brain is 25% of your body's total cholesterol? Your nerves need cholesterol to maintain the myelin sheath. Statins, the drugs used to lower cholesterol, have a known side effect of neuropathy. I am not telling you to stop your medication. That is a conversation for your doctor, but I am telling you to have an informed conversation. If your nerve pain started after you began a statin, you need to ask questions. You need to support your body with coenzyme Q10, which is depleted by these drugs and is essential for nerve energy. We are covering a lot of ground here, and I hope you are taking notes, or at least letting this information wash over you. You don't have to be perfect. You just have to be 1% better than you were yesterday. Let's talk about a super drink you can make at home. I want you to replace your morning sugary juice with this. Warm water, a slice of lemon for alkalinity, a pinch of cayenne pepper. Why cayenne? It contains capsaicin. Capsaicin temporarily desensitizes pain receptors and increases blood flow dramatically. A quarter teaspoon of turmeric powder for the curcumin. And this is the secret, a pinch of black pepper. The piperine in black pepper increases the absorption of turmeric by 2,000%. Without the pepper, the turmeric just passes through you. Drink this first thing in the morning. It's an anti-inflammatory bomb for your system. Now, I want to touch on the emotional component of pain. Chronic pain changes your brain. It creates a pain map. The more you focus on the pain, the stronger the connection becomes. It's like a dirt road turning into a highway. We need to use neuroplasticity to pave a new road. This is where graded motor imagery comes in. Sometimes just imagining moving your painful foot without pain can start to rewire the brain. Visualize yourself walking on the beach, the sand between your toes, feeling good. Your brain releases dopamine and opioids, natural painkillers, when you visualize vividly. It sounds like magic, but it is hard neuroscience. I want you to consider the shoes you are wearing. Most modern shoes crush our toes together. This compresses the metatarsal nerves. Look at a baby's foot. The toes are spread wide. Look at an adult's foot. They are shaped like a shoe. This deformation cuts off circulation. When you are home, take your shoes off. Wear toe spacers if you can. Let your feet breathe and spread. We need to uncage your feet to heal your nerves. As we move toward the advanced insights, I want to talk about the spine-gut connection. Your gut produces 90% of your serotonin. Serotonin regulates pain. If your gut is inflamed, leaky gut, bloating, indigestion, your pain threshold drops. You feel everything more intensely. This is why bone broth, collagen, and fermented foods like sauerkraut are part of the nerve healing protocol. They seal the gut lining. When the gut calms down, the nervous system calms down. I also want to warn you about phantom posture. Many of us sit with our heads forward, looking at phones or screens. For every inch your head goes forward, it adds 10 pounds of weight to your neck. This crushes the cervical nerves that travel down your arm into your hands. If you have numbness in your fingers, look at your neck. Do the chin tuck. Pull your chin back like you're making a double chin. Hold it for 2 seconds. Release. Do this 10 times a day. You are physically decompressing the cervical discs and taking the pressure off the brachial plexus. You might feel the blood rush back into your hands immediately. This journey of healing is not a sprint, it is a marathon. But the beautiful thing is that the results compound. When you start sleeping better because of the pillow, your inflammation drops. When inflammation drops, the Benfotiamine works better. When the nerve starts to fire correctly, you can move more. When you move more, you get more circulation. It is a positive spiral upward. I want to share one more insider secret regarding medical tests. Electromyography, EMG, and nerve conduction studies are the gold standard, but they only test the large nerve fibers. They do not test the small nerve fibers. Small fiber neuropathy is incredibly common, often causing burning and temperature sensitivity, but it comes back normal on the big tests. If your doctor says your tests are normal, it's in your head, do not accept that. Small fiber neuropathy is real, and it responds beautifully to the lifestyle changes we are discussing, especially the elimination of sugar and the addition of alpha-lipoic acid. Listen to me, friends. You have been the CEO of your own suffering for too long. It is time to become the CEO of your own health. The pharmaceutical industry is not evil, but they are a business. A patient cured is a customer lost. I want you to be a lost customer for them. I want you to be free. I challenge you. I challenge you to take the next 7 days and commit to this protocol. Cut the seed oils and excess sugar. Take your B vitamins, the right forms, and alpha-lipoic acid. Do the nerve flossing and the chin tucks. Practice the humming breathing before bed. Drink the turmeric cayenne elixir. Keep a journal. Write down your pain level from 1 to 10 every morning. I promise you, if you stick to this, you will see that number shift. It might be slow at first, like a heavy flywheel, but once it starts moving, the momentum of healing is unstoppable. I have seen people in their 80 seconds regain sensation. I have seen people cancel back surgeries. Your body is a miraculous, self-regenerating machine, but you have to stop putting sand in the gas tank. In my next video, I'm going to reveal a specific sleeping position that not only helps sciatica, but actually helps decompress the neck for those with hand numbness. It's a game changer. But for now, focus on this. Focus on the hope that is bubbling up inside you right now. That feeling, that is the first step of your recovery. If you are ready to take control, if you are ready to say enough is enough, I want you to leave a comment below. Just type the word committed. That is a message to yourself, not just to me. It is a psychological anchor. Type committed and let's start this journey together. Please share this with someone you love who is suffering. Pain isolates us, but healing connects us. Subscribe and turn on that notification bell because I have so much more to share with you. Secrets that have been buried in dusty books and clinical studies, waiting for someone to bring them to the light.